Infectious diseases such as COVID-19 can have a long-lasting and detrimental impact on the protective environments that children need to grow and develop. COVID-19 has created unprecedented restrictions on people's movements, decreased access to child protection services, and led to the worldwide closure of schools. 188 countries have imposed countrywide lockdown measures, affecting the lives of more than 1.5 billion children and youth. In these circumstances, abuse can be perpetrated by all those who have a duty to protect and care for children, including aid workers, both intentionally and unintentionally. In this video, you will learn about the child safeguarding risks that arise during pandemics such as COVID-19. We will share suggestions as to what we can do as War Child staff to prevent abuse and to protect children. Child safeguarding is a set of organisational policies, procedures and practices that we employ to ensure War Child is a safe organisation responsible for protecting children from the risk of harm and abuse caused by those who have a duty to protect and care for them. At War Child, we are concerned that the spread of COVID-19 and the lockdown measures imposed can cause an increase in abuse, harm and exploitation. For example, families can be separated from each other due to isolation and quarantine measures, and children may be at increased risk of abuse and exploitation if no one is present to care for them. The increase in online communication can lead to cyberbullying and exploitation. The lack of access to safe spaces such as schools, child-friendly spaces, community centres and safe houses, as well as the decrease in access to child protection services, may mean that children have nowhere safe to go and no trusted adults to speak with. Children and adults living with disabilities are 10 times more likely to be victims or survivors of abuse. During the current COVID-19 pandemic, access to support services, trusted individuals, and safeguarding reporting systems will decline. All these factors create an enabling environment for those who want to exploit and abuse children at risk. War Child is still responsible for the safety of children we work with. Our responsibility to safeguard children must align with your country's national regulations and World Health Organization guidelines. As we adapt our activities to respond to COVID-19 and implement infection prevention and control protocols, we need to be aware of the additional safeguarding risks that may occur. What risks do you need to look out for? Verbal or physical abuse. This can also take place online or through mobile phones. Staff or representatives may isolate a child at a facility or in their own home to sexually exploit or abuse them. Opportunities for children and parents or carers to report abuse decrease due to fewer staff or representatives in the field, as well as a lack of access to reporting mechanisms, trusted adults and mobile phones. Due to physical distancing and movement restrictions, staff are no longer able to monitor programs in person or meet with children to make sure that they are safe. Abuse of a child or caregiver using online, social media or mobile communication such as WhatsApp or Facebook, with the risk of this heightened as increased time is spent online. Power imbalances are further exacerbated between aid agencies and communities. Aid workers have access to life-saving goods and services that children and their families require. As demand increases and supply decreases, the opportunity to exploit this power gap grows. Regardless of the emergency, War Child always operates a zero-tolerance approach to all forms of abuse, harm, neglect, stigmatisation and/or exploitation. Please refer to the Code of Conduct and the Child Safeguarding Policy within 24 hours. Here are some practical tips and considerations for you as War Child staff. If you are in the field, please implement all of the WHO and local government guidelines on physical distancing and safe hygiene practices while interacting with children and the community. When working remotely, avoid direct communication through personal social media like WhatsApp or Facebook with a child or caregiver unless agreed with management and following the online safety guidelines and protocols. You must only contact children and their parent or carer using a War Child owned SIM card and device, and you must never give out your personal details. Be mindful of how you describe COVID-19 to children. It is not a monster. Children might be anxious, worried or scared. Encouraging them to sing whilst washing their hands can help them feel less stressed. Be aware of rumours and myths around COVID-19. They might not be true, and they might cause more harm to children. Track them and give the official information to questions raised around the issues. Ensure that field staff are grouped in 2 or 3 persons of mixed genders and that activities do not take place behind closed doors. If you are working online, make sure there are 2 members of staff in each online group or forum unless you have approval of your line manager as part of case management. Ensure there is at least 1 local channel, or when absent, an international one, that is easy for all to access to feedback and report any concerns that they may have. Managers must continue to champion safeguarding. As a manager, you must ensure risks are assessed when you adapt your programs for COVID-19. You must continue to keep children's data safe. Store it in a safe, lockable space and replace all names with codes. Do not store sensitive, confidential information about children in your home. It must remain safely in the War Child office. When working with partners, share with them all the policies, guidelines and e-learning modules on child safeguarding. Make sure that they have a child safeguarding focal point and agree on reporting pathways between War Child and the partner. Take care of yourself and never hesitate to reach out and ask questions when in doubt. Your child safeguarding team is here to support you. We are all responsible for the safeguarding of the children we work with. If you have a concern for a child, you must report this to your in-country focal point within 24 hours. You may be the only person who is keeping them safe from harm. Help each other where you can, support your colleagues, and together we can keep everyone safe from harm. Thank you.